Hi, I'm Phil. I'm a psychotherapeutic counsellor and a trauma therapist. This is a continuation of an earlier video I did about how our unique response to trauma can subconsciously influence our behaviours, even when we're experiencing lower levels of anxiety. So, in the last video, I spoke about how in times of shock, we typically default to either fight, flight, freeze, appease, and collapse. And that when we do this, a series of behaviours that are relevant to each of those survival reactions will become active for us to help us to survive that shocking situation. And which of these responses we go to depends on who we are as a person, and it's our subconscious that has control over that choice. So these videos, they're looking at how even when we're experiencing low levels of anxiety, that this default response can have us acting out lower level behaviors that belong to whichever fight or flight defense we naturally go to. In the first video, I spoke about the behaviors typical to fight and flight, and in this one, I'm going to discuss freeze, appease, and collapse. So I'll start off with freeze. So a trauma level freeze reaction, well, it'll do what it says in the box, which means we literally might not be able to move in a dangerous situation because the brain's thinking that we're more likely to be killed if we do. And it's typically our freeze and also our appease that prevents children and adults who are victims of abuse from reporting or confronting their abuser, especially children, because when we're small, adults are really big. So to fight or escape, probably not going to be options that are available to them. So go to freeze, appease, or collapse into some sort of dissociative state so they can desensitize themselves to the world around them or what's happening to them are probably going to be the only options they've got. So if freeze is our default option, then even at low levels of anxiety, we might start to feel the need to minimize our presence in the world because the smaller we are and the fewer people who see us, the safer we're going to feel. So that means that shyness, avoidance, introverted behaviors are probably going to become more dominant for us. And on top of that, we might start projecting our fear onto things in the environment and developing phobias about them. So we might project our fear onto work or buses or shops, and then we're going to feel scared of these things and avoid them. And that's going to make us more agoraphobic, which gives us more inclination to stay in and freeze at home. We might also feel a draw towards solo activities, which means that we might start to feel less interested or inclined to do stuff with friends and family. And we're also likely to procrastinate more or put things off because doing stuff is movement and we're wanting to freeze. We could also feel the need to dress down or talk quietly so we're not so easily seen or heard. And at home, we might find ourselves avoiding upsetting the neighbours by tiptoeing around or keeping the TV volume really low. Our freeze might also influence us to stay in bad relationships or bad jobs or bad friendships because getting out is going to feel scarier than staying in, as getting out is movement and our brain's telling us that movement's dangerous. So to assist us to stay in these bad relationships, we might also convert our fear into guilt, which means that we might start to feel guilty about leaving instead of scared. So in effect, guilt gives us reasons to stay that aren't so scary. Or we might project our fear onto others and believe that I have to stay with this person or bad things will happen to them. What's also likely to happen is that we're likely to also lose our capacity to show anger or be angry around people because that's going to draw attention to us. The freeze person doesn't want confrontation, is terrified of confrontation. So anger's probably going to be an emotion they block out completely. It could also be that we start to develop a deeper sense of shame about our capabilities or appearance, because if we feel bad about ourselves or ugly, then that's going to deter us from being around people. There are just so many tricks that our brain can access to manage our fear responses. And another one with freeze might be that it could invite us to begin to experience symptoms of depression, which is going to massively invite us to withdraw and hide ourselves away. And in the same vein, we might start feeling more lethargic, fatigued, or excessively tired because there's just no better freeze position than being totally unconscious in sleep or immobile. We could also be drawn to alcohol, drugs, medicines that will slow us down or desensitize us from our anxiety. So this might be cannabis, sleeping aids, or anything really that has a sedative effect. And dopamine creating behaviors such as sex or masturbation might also be craved to give us a quick fix or be temporarily able to take the edge off the anxiety. But we need to be mindful of this because if we're dependent on dopamine to manage our anxiety, then we might easily become addicted to whichever dopamine forming behavior suits our default fight or flight response. I can't say for sure about the influence of a freeze defense on blood pressure because I'm not a doctor, but a number of people I've worked with who use freeze and appease as a trauma response have been diagnosed with low blood pressure, which I guess might assist them to remain calm and still in a crisis. In the same way that people who go to fight or flight might have high blood pressure, so they can instantly react to situations. But like I say, I'm not a doctor, and I probably need to do a bit more research in that area. So now I'll talk about appease. So a trauma level appease defense, which is also known as fawn, has us unconsciously believing that if we submit or bow down to the power of the aggressor or work to please them, that they might not kill us. So if you have this defensive style as your default, then as your anxiety grows, this might invite you to start feeling weaker or less confident around certain people or just people in general, which is going to impact our capacity to set boundaries, voice our opinions, or challenge the opinions or behaviors of others. And this could even mean that we might even struggle to put posts on social media or advertise something that we're planning on doing, because that's us talking about our stuff when our appease is telling us that we need to prioritize the needs of others. And the same might apply to pastimes and hobbies and interests that we would normally enjoy, because our interest now is likely to be suddenly more directed on the interest of others. We might even start to idealize the people that we're appeasing, which means that we'll only see them in a positive light. So if we're idealizing, we might not be able to acknowledge or even feel that the behaviors of others might be unethical, immoral, or even dangerous. So like freeze, it could also invite us to stay in dangerous situations, because acknowledging what's happening to us and getting away would be going against that appease defense. And to help us keep appeasing people, we might also convert our fear into guilt that we'll manage by looking after others or by being an exceptionally good moral person. So as long as we're doing good deeds, we don't feel guilt, and therefore we don't feel fear, which also means that we might start to suppress our capacity to feel anger or convert our anger into guilt too, because getting angry at someone is totally the opposite of appeasing them. So to our brain, anger is going to be a very dangerous emotion that we're going to need to get rid of. We might also start to appease our employer, and that's going to make us overly keen to accept extra work or even seek it out, just so our boss knows that we're being a good employer, so they won't become a threat to us, which means we could eventually collapse into burnout or slip into a flight or a freeze defense, which would make us feel the need to avoid the work environment completely. So now I'll talk about collapse. So if we go into a trauma level of collapse, we're usually doing this because our process perceives that fight, flight, freeze, or appease are just not sufficient for survival in that moment. So all that's left is the option to shut our system down completely, suppress the capacity to feel or to comprehend anything. So nothing can be acknowledged or felt. So it's probably going to be unlikely that we get too many lower levels of collapse. But we could say that if we get burnt out appeasing someone, or if we're too exhausted to fight or flight, then we might collapse into a freeze position so our bodies can recover. We could also say that dissociation might be an element of collapse too. Well, it will be a big element of collapse, because people who dissociate do have the capacity to shut themselves off from their experiences in the moment. I guess a full experience of collapse would be someone going into almost like a coma-like state, whereas some people who dissociate do it just for a few seconds or a minute or so. And from my experience of working with traumatized people, I sometimes find another factor that seems to connect to collapse. And it's one where people become so helpless that they lose a lot of their adult functioning and become very childlike in how they present. And if we think of it logically, there might be a genetically programmed part of our brain that tells us not to hurt very young, defenseless children. So collapsing into a child state might serve some sort of security purpose. But this might also come about as a result of someone's historical childhood trauma being triggered by something in the present, which means that their childish behaviors might be the result of them regressing to an age that they were at the time of their original trauma. But I guess we could still call that a collapse of sorts. So that's the defenses done. But there are likely others for you to recognize in your own time, because, gosh, trauma is complex, and how our anxiety keeps us safe. There's going to be new ways. There's going to be ways that I haven't spoken about. And changing or adapting these behaviors is probably going to be difficult, because the hypervigilance that's being created by the elevated levels of anxiety makes us believe that if we're not hypervigilant, that bad things are going to happen. So that means that it's going to want to keep those anxiety-driven behaviors in place. We want to stay in a level of hypervigilance that's normal for us. So if we can begin to understand the concept that some of our behaviors, even the good ones, might be anxiety-driven, Then we can work towards understanding their purpose and challenging their usefulness. But just challenging them isn't going to be enough to reduce your anxiety, because the reason that they're occurring in the first place is because you're anxious, which means that if we're going to adapt our behaviors, then we need to find ways to support ourselves through the anxiety that we're going to feel if we stop using the compensatory behavior. Because if we don't do that, then we might just launch into another anxiety managing behavior to fill that gap. So in effect, what we need to be doing is upping our levels of self-analysis, which helps us spend more time in the logical part of our brain, which is going to be useful, as that part of the brain isn't the part that's producing our anxiety. So in effect, thinking logically about things directs the attention of the brain away from the production of anxiety into more rational thinking. And to accompany this, if we can work towards making self-reassurance a bigger habit, then this is also going to help, because that's us giving ourselves even more control over what our mind is doing, what our mind is thinking. So it's about us developing a greater capacity to be more in control over what our brain is doing. And this takes time, and there will be resistance to change, as anxiety can be really stubborn. But usually with a good bit of practice, we can often make some headway over time. And this might help us in the future too, because if we've got good at analysing and reassuring, then we might be more easily able to draw on those skills in the future. And if something triggers us into heightened levels of anxiety again, because I guess if we know how to deal with it this time, we might recognize when we go into it next time and remember sooner how we dealt with that situation and be able to pull ourselves out of it. Well, hopefully that was useful for you. And if you'd like me to discuss any points in more detail, just drop me a message in the comments and I'll see if I can do you a video. Well, thanks for watching, and take care, and goodbye.